Okay. So the first question is, what do you know about the history of health education related to this field? I know quite a bit about um, strokes actually from personal experience with family, but also I researched with the American Heart Association, also the American Stroke Association, and so I read up a lot about just education on strokes in general. And for instance, in 2013, the American Heart Association and also the American Stroke Association categorized strokes in four subcategories. So that, or four subtypes. So that is something that is very different, um, and very interesting to learn about. That there are four subtypes of the disease. What are the main differences between dealing with this health issue 50 years ago versus today? I would say more knowledge about the health issue, back, in the AD times, or BC times, there wasn't a lot, um, about the disease, and as well as even, 50 years ago, in the 60s, there wasn't a lot about the disease. um, stroke. So I think at that time, healthcare professionals were still learning about the disease, but now it's, like I stated before, there are, four subtypes of a stroke itself. It's not just they had a stroke. What type of stroke? That has changed over the course of 50 years. Um, let's see, what are the most significant trends in the field of health education related to the health issue today? I would say stroke risk reduction. Just promoting patients to get regular blood pressure screenings, regulation of hypertension, diet, and nutrition. Also, obesity, diabetes, and smoking. Those are things that, patients are being taught to help reduce the risk of a stroke. Let's see. Despite our progress in dealing with this health problem, why do you think it still occurs in such frequency? I would say because of the trends I've mentioned before, still occurring in the patients and also patient behavior. Um, Smoking, not proper diet and nutrition. Those are things that, a lot of us Americans, and people in general don't like to practice or, make that lifestyle change. So I think that's why, even though people are being taught about the disease, it's still frequent because of those behavior problems or issues. Um, and also, like I said, just practicing a good proper diet and nutrition, and also staying on top of your screenings, things like that. Which people struggle with this health issue the most? I would say the elderly population, as well as people who are obese and also diabetics. From reading um, the information about strokes, I saw that those were some of the most common people or age groups that the disease occurred in. In your opinion, why are health educators vital in improving people's health in this area? I would say health educators are very important because we can educate those populations that may not go to the doctor to get educated on, stroke and risk factors, managing a good, healthy weight and diet. If they were to come to a seminar or a conference or, to a class, I think we can reach them on a more personal level than, say, someone who only goes to the doctor for their physical. They only spend 5 minutes in the office with their physician, about a health issue versus, an educator, I think can, reach them and get on a more personal level with them as far as not just, you know, talking about their health and what they should do. We can get the message across, the same message that the physician is trying to get across, but I feel we could get it over, in a way that they may be the patient or the person we're teaching may be more receptive of the information. Why are you the best candidate for the job out of all people who applied? Let's see. I would say because I'm very knowledgeable about the position and also the disease, working as um, an associate advisor, I feel that I meet not only the qualifications, but I'm also a very caring person. I love to promote a healthy lifestyle. I feel if I'm chosen, I would be a very valuable asset to the company. And like I said, I'm always up for, obtaining more knowledge. And I feel like because I, like to learn and educate myself, I can better educate the population that we're trying to help live a healthier lifestyle. So I feel like I would be a great candidate, and also a great asset to the company in that aspect.